Hello and welcome to this audio podcast. This audio podcast as part of a Papillae Sirocco series, as part of the Papillae Sirocco series, as part of a Labostix Communicado, an audio podcast as part of a Squadron Kamikaze, and an audio podcast as part of a Storm Labostix production. A little bit in this audio podcast, I'm going to delve into a little bit more around the laboratory investigations, a bit more around the laboratory investigations, and sort of before going on to sort of looking into some further aspects around this peer review works. So so the uh, in a previous audio podcast, there was a little bit in around what a histological staining would look like in recipients or patients diagnosed with HUS, and where a fibrin histological stain would show sort of the microangiopathic disorder or syndrome, a syndrome around the glomeruli of and the glomeruli, and where histological staining can highlight or can highlight and has and in evidence works has highlighted sort of where there's a platelet fibrin, thrombi, and where generally around where the glomeruli are where the glomeruli are generally are generally under a histological stain, show a sort of a microangiopathic, where there's a microangiopathic disorder. The blood vessels around the sort of glomeruli are microangiopathic, and thus the coagulation, the coagulation and the clotting around the glomeruli become sort of more pronounced and through histological findings, and so in around the sort of more in around some of the more around around HUS, and sort of the main sort of findings, if you like, around the morphology, around the morphology, in line to hematology investigations. So under in morphology, under sort of under microscopic or morphology investigations, HUS red cell the red cell morphology show sort of a red cell fragmentation with obvious schistocytes, which are a sort of a fancy name, really, if you like, for sort of helmet type looking red cells. So if you imagine a red cell in a normal red cell, has a sort of a concave look under microscopy. In morphology, in HUS, in hemolytic uremic syndrome patients, there's fragmentation, and there's fragmentation around red cells, and there's red cells that are not not complete, the concave aspect around the red cell, which are known to be those parts of the red cell which carry oxygen, or which are generally oxygenated, or show that they're oxygenated, are generally sort of split, or show helmet, or have sort of a helmet sort of disfiguration under morphology, under morphology, and also There's a decrease. There's also a decrease in platelets, which is typical in HUS patients. The schistocytes or the helmet type red cells are irregularly shaped fragments with a sort of two-pointed end without central pallor. Without a central pallor, so the sort of concave aspect and the oxygenated aspect of the red cell are completely sort of detrimented owing to the symptomologies around HUS. HUS also in around the morphology. There's peripheral blood smear depicts sort of a striking red cell fragmentation. Findings of microangiopathic hemolytic anemia, and to also inform that HUS is a form of a hemolytic a sort of a sort of a is also known as a form of a hemolytic anemia. A form of a hemolytic anemia. There's deformed and irregular helmet shaped red blood cell or schistocytes. Thrombocytopenia, which show platelet count of less than of around 50 or less, and neutrophils. The neutrophils are one of the main sorts of cell types in sort of guarding and protecting in morphology, may be quite marked and show a sort of a marker of adverse prognoses. There's also polychromasia, so much like a hemochromatosis in some patients where there may be iron deficiency. There's a grayish tinge or polychromasia in around the red cells, which may be marked. The bone marrow is cellular, and there's a response. Is a response, and there's a response to the red cell fragmentation and a red cell breakdown being hemolysis, and at the same time, in around the chemistry, the sort of biochemistry and the microbiology investigations. So the urea creatinine electrolytes sort of demonstrate abnormally high results. The urine, if present, may contain a protein and red blood cells. The liver function tests or LFTs may be normal. The urine on dipstick investigations can show some protein leaking, and so historically in patients, specialists have warranted or required a 24-hour urine collection in peds and young people who may be suspect or at risk for HUS. However, in more recent literature, the 24-hour urine collection, 24-hour urine sort of collection to determine sort of a sense of protein leaking may only be required for those patients who are formally admitted into hospital care. Electrophoresis can be helpful. Electrophoresis can be helpful and important to establish extent of protein leaking. Blood urine nitrogen or BUN is markedly elevated. And around the sort of HUS microbiology, the cultural species of E. coli. E. coli being one of the main sort of infections prompting HUS. So cultured species of E. coli is performed mainly the enterohemorrhagic E. coli or EHEC is sort of the investigations that specialists normally put forward to the laboratory teams to help to help identify more specifically whether a patient is suspect or at risk of having HUS, and so there's also in the peer review works from 2017. There's also some sort of further histological stains of a renal biopsy specimen, and is the histological staining of the renal biopsy specimen is it shows a sort of a it shows a sort of the sort of bases in around the glomeruli sort of around day 37 following a specific monoclonal antibody treatment. So for example, in eculizumab treatment has been quite sort of famous for HUS or in HUS in more recent times. Historically, eculizumab had not been a monoclonal antibody that had been used or utilized. However, in the peer review works, there's sort of histological staining showing the sort of the grading of HUS, or sorry, showing the grading of the glomeruli according to eculizumab treatment, and so listeners are welcome to check out the full peer review works, as part of this audio podcast, to get a basis in around the histological basis around HUS, and so that draws this audio podcast to a close. As part of a Papillae Sirocco series. This audio podcast as part of a Labostix Communicado, an audio podcast as part of a Squadron Kamikaze, and an audio podcast as part of a Storm Labostix production.